which is used to describe the presence of red blood cells in the urine, that is RBCs. It can vary in appearances, ranging from pink or red tinged urine to brownish or every or even bloody urine. Now, next, we'll talk about the various types of hematuria. So, there are mainly two types of hematuria. One is gross hematuria, and second is microscopic hematuria. First, we'll talk about gross hematuria, then later on, we'll talk about microscopic hematuria. So, let's talk about gross hematuria. So, if there is enough blood in your urine that your urine appears pink or red or has spot of visible blood, so you have gross hematuria. Second type we have is microscopic. So when you cannot see the blood because the amount is so small and you have microscopic hematuria, only a lab test that detects blood or looking at the samples of urine under a microscope can confirm microscopic hematuria. So these are the two types of hematuria. I hope they are clear to you guys. Now next we'll talk about the causes. So let's talk about the etiology. What are the basic reasons, potential causes which are responsible for blood in urine, or you can say hematuria? So, first and the foremost cause for hematuria is UTI, that is urinary tract infections. So, let's talk about it. So, these happens when bacteria get into the tube through which urine leaves the body, which is called urethra. Then the bacteria multiply in the bladder. UTIs can cause bleeding that makes urine look red, pink, or brown in color. And with a UTI, you also may have a strong urge to pee that lasts for a long time. You may have pain and burning while doing urination. Your urine may have a very strong smell too. Now, second cause we have is kidney infections. So this type of UTI is also called as pyelonephritis. So kidney infections can happen when bacteria enters the kidney from the bloodstream. Infection also can happen when bacteria moves to the kidney from a pair of the tubes that connected the kidney with the bladder called ureters. And kidney infections can cause the same urine related symptoms that other UTI can. Third cause we have is a bladder or the kidney stone. The minerals in the urine can form crystals on the walls of the kidney or the bladder, and over a time, the crystals can become small, hard stones. Next cause of hematuria is enlarged prostate. So, the prostate gland is just below the bladder and it surrounds the top part of the urethra. It often gets bigger towards middle age, and if it then puts pressure on the urethra, partially blocking the flow of the urine. And with an enlarged prostate, you might have trouble doing urination and urgent or lasting need to urinate or blood in the urine. So, infection of the prostate called prostatitis can cause the same symptoms. Next cause of hematuria is kidney diseases. So, blood in the urine that can be seen only in the lab is a common symptom of kidney diseases called glomerulonephritis. With this disease, the tiny filters in the kidney that removes the waste from the blood becomes inflamed. Next cause is cancer. So, blood in the urine that can be seen with the naked eyes may be a sign of advanced kidney, bladder, or prostate cancer. These cancer might not cause symptoms sooner, but when treatment could work better. Next cause is inherited illnesses. So, a genetic condition that affects RBCs, red blood cells called sickle cell anemia, can cause blood in urine. The blood cells could be visible or too tiny to see. A condition that damages tiny blood vessels in the kidney called Alport syndrome also can cause blood in the urine. Now, next cause for the hematuria is kidney injury. So, a blow or the other injury to the kidneys from an accident or contact sports can cause blood to show up in the urine. Next cause for hematuria is medicines or medications to the blood in the urine, and these medicines prevent blood clots also are tied to the blood in urine, and these include medicines that keep blood cells called platelets from sticking together, such as a pain relieving aspirin, medicines that thins the blood, such as heparin, and may be a cause. So these type of medications can cause blood in urines. Okay, heparin, aspirin, cytoxin, okay, and blood thinning medicines. So they cause blood in urine. Next cause we have is hard exercises. So this is the last cause. Let's talk about it. So blood in the urine can happen after playing contact sports such as football. It may be linked to the bladder damage causing by getting hit. Blood in the urine can also happen with the long distance sports such as marathon running, but it's less clear why it might be linked to bladder damage or other reasons that do not involve any injury. When hard exercises causes blood in the urine, it may go away on its own within a week. Okay, so these are the various potential causes which are responsible for blood in urine, that is hematuria. Now let's talk about the risk factors. So almost anyone can have red blood cells in the urine, and these include children and teenagers. Something that can raise the rise of blood in the urine include age. First risk factor is age. So middle-aged and the older men may be more likely to have hematuria due to an enlarged prostate gland. The risk of some cancers that can cause blood in the urine also may rise after the age of 50. Second risk factor is urinary tract infection. Third is family history. And next is certain medications. And the last one is hard exercises, as I have already said. So these are the risk factors which are responsible for hematuria. Now we'll talk about the clinical feature, that is, what are the symptoms of blood in urine. The primary symptom of hematuria is the presence of blood in the urine. Other symptoms may include pain or discomfort during urination, frequent urination, and abdominal or flank pain. Okay. Now we'll talk about the investigation, that how is the cause of hematuria diagnosed. So let's talk about the diagnostic criteria. Okay. So if you are seeing your doctor for hematuria, they will ask you about the amount of blood and when you see it during urination. They will want to know how often you urinate, any pain you are experiencing, if you see blood clots, and what medications that you are taking. So your doctor will then give you a physical examination and collect a sample of urine for testing, that is urine sample. The analysis of the urine can confirm the presence of the blood and detects bacteria if an infection is the cause. Next, your doctor may order imaging tests such as CT scan, which uses radiation to create an image of your body. Next test we have scopy. This involves using a small tube to send a camera up your urethra and into your bladder. So with the camera, your doctor can examine the interior of your bladder and urethra to determine the cause of the hematuria, that is blood in the urine. So these are the various investigations that one can perform in order to diagnose the cause of hematuria. Okay, this was all about the diagnostic criteria. Now let's talk about the treatment. So what is the ultimate treatment for blood in urine or hematuria? So yes, we are talking about the homeopathic treatment for blood in urine. Now we'll talk about the homeopathic medicines that has been successfully used for the treatment of blood in urine. The selection of the homeopathic medicines for the blood in urine for every individual cases should be made after a detailed case analysis. These medicines should be taken only after consulting a homeopathic physician, and self-medication should be avoided. So first and the foremost homeopathic medicine that you can see here on the screen for the blood in urine is nitric acid. So, nitric acid is a very powerful homeopathic medicine for the blood in urine when the urine is offensive in nature. The smell of the urine is strong and highly offensive. Along with blood, albumin may also pass in the urine. Urine is dark, bloody, scanty, and foul. Urine may feel cold while passing, and in a few patients, chilliness in the spine appears along with bloody, dirty urine. Now, second medicine for hematuria is uva ursi. So, this is the best homeopathic medicine for the treatment of blood in urine. when the urine contained blood cells and large quantity of sticky mucus. So pain in the bladder and the urethra while passing urine appears along with the hematuria, that is blood in urine. The nature of the pain is tearing and spasmodic. The urge to pass urine is also frequent. So this medicine works well when the kidney stone pain accompanies mucus and blood in the urine. Third medicine we have is Trivinthina oleum. So Trivinthina is an effective homeopathic medicine for the treatment of blood in urine where the urine has coffee ground sediments. The urine appears dark or black and is mixed with blood. Trivinthina is useful remedy for hematuria caused by inflamed kidneys that follows an acute disease. There is a burning, cutting pain in the urethra with strangry and tenesmus with blood in the urine in cases where Trivinthina is prescribed. This medicine also works well when albuminuria accompanies hematuria. Now, our next homeopathic medicine for blood in urine, we have two medicines that is Cantharis and Apis mellifica. So, these two homeopathic medicines are used for blood in urine accompanied by burning urination. Now, one by one, we'll talk about them. First of all, we talk about Cantharis. So, Cantharis works well when a cutting burning in the urethra is present with bloody urine. The burning is present before, during, and even after passing urine. Urine is passed drop by drop with blood, and there is a constant desire to pass urine. Strangry and bladder tenesmus can also occur. Second medicine we have is Apis. So, Apis mellifica is a good homeopathic medicine for blood in urine cases where there is a burning and stinging pain in the urethra. Burning is most prominent when passing the last drop of the urine, especially. Urine is scanty, scaldy, and bloody, and there is an inability to retain urine even for a moment when the urge appears. Okay, now next two medicine we have is Berberis vulgaris and Lycopodium. So these two homeopathic medicines are especially used for blood in urine because of the kidney stones. Now one by one we'll talk about them. First of all, we'll talk about Berberis vulgaris, then later on we'll talk about Lycopodium. So Berberis vulgaris is a highly recommended homeopathic medicine for blood in urine when it is accompanied by left-sided kidney stones. Along with blood, jelly-like sediments or thick mucus may also appear in the urine. In such cases, sharp pain in the left kidney that extends down through the ureter into the bladder and urethra is also a symptom. Second medicine we have is Lycopodium. So Lycopodium is as effective a remedy as Berberis vulgaris for hematuria with renal calculus, means kidney stones. So Lycopodium works well when blood in urine accompanies right-sided kidney stones. Person requiring lycopodium have right-sided kidney pain along with blood in urine. Urination relieves the pain for a while. The urine contained red sand is scanty and passes with a burning sensation. The patient may also need to urinate frequently at night. Okay, so these are the homeopathic medicines which has been successfully used for the treatment of hematuria, that is blood in urine. So that's all. In conclusion, I want to say that hematuria, or the presence of the blood in urine, is a symptom that should never be ignored. While it can be caused by a range of conditions, and some of which are benign, it can also be a sign of more severe issues. Prompt medical attention and proper diagnosis are essential for understanding and addressing the underlying cause of the hematuria, that is blood in urine. So if you find this video informative and helpful, please give it a thumbs up and subscribe to our channel and hit the notification bell so you won't miss any future content. And thank you so much for joining us today, and we'll see you in the next video. Till then, stay safe and stay healthy. And if you are suffering from hematuria or any other health illnesses, then you can contact us for online appointments. On the screen, you can see how you can contact us for online consultations. So that's it for now, and thanks for watching this video.